I'm going to talk about Medicare fraud and abuse and how you can help stop what's going on. So, very important stuff. Stay tuned. I'm Keith Armbrecht, founder of Medicare on Video. I hope you'll find the information in this video very helpful and presented in an easy to understand format. Turning Medicare eligible is actually a very good thing. You'll likely find Medicare to be a much better alternative for your health insurance needs than what you may have had previously. But there are some choices. So I've created a Medicare Resource Center where I have a complete video library on everything Medicare. You'll also find all the necessary links and the guides and the forms that go along with them. So after this video, take just a few minutes to explore our Resource Center. I'm sure you'll find everything that you need for Medicare. You can also get an immediate quote for your Medicare supplement insurance. Just fill in your basic information and it'll bring up the rates for the plans that are available in your area. It would also be a great idea to subscribe to my YouTube channel. That way you'll always have access to my videos and you'll get updates as they come along. So again, I hope you find this information very helpful, and please let me know if I can help. Okay, so let's talk about Medicare fraud and abuse. And this is actually a very important topic and something that I personally find that we need to take a little bit of responsibility for and try and help prevent Medicare fraud and abuse. I'm going to go through this guide, which is Medicare Fraud and Abuse Prevention, Detection, Reporting. It's provided by CMS, which is the Center for Medicare Services, and certainly a very important guide to have. So something you should have. You probably don't have it now, but if you'd like a copy of it, pretty easy to do. You can go right to my website and MedicareOnVideo.com. If you go to MedicareOnVideo.com, just in the top left-hand corner, you'll find Resource Center. Click right on Resource Center. It'll drop down a box, and at the bottom you have guides and forms. So I have uploaded this into the guides and forms section on MedicareOnVideo.com. You can see to the right-hand side on the second level is this form. So if you click on that, it'll download right onto your computer. You will have it from then on. So, and it's actually a very good guide. It actually has clickable links where when we start talking about things, if you want to do something, you just click on the link. It takes you right where you want to go. So I'm actually pretty impressed with Medicare putting this together and making it easy for us to find the things that we need to do. So this is something that I take kind of personally very seriously. And, you know, I kind of recollect back to when probably 15 years ago, 20 years ago, I was on regular health insurance. And when I'd gotten my statement in the mail, kind of my explanation of benefits, there was something that I didn't think was accurate. And I called, it was Blue Cross that I had at the time. And I still to this day remember this. I'm not sure exactly why, but I called Blue Cross and I said, you know, this does not look correct. And the response that I got was, what do you care? We pay for it. And, you know, it kind of threw me for a loop at the time, but I didn't really put too much into it. But absolutely true, especially in Medicare, there is so much abuse and so much fraud that we need to make sure that this program stays with us. And it may be the best government program there is. There's certainly a multitude of government programs. Most of them don't run very well. Medicare actually runs really well and does pretty much exactly what it's supposed to do. So we want to make sure that it stays here and that we do whatever we can to help it stay here. And I'll show you exactly how to do that. And it's pretty simple, just kind of understanding and knowing some things that you can do to help. So we have a government office called the Government Accountability Office. And obviously what that does is it looks at different things and tries to hold them accountable to what they're supposed to be doing. So they oversee some of Medicare stuff. And Medicare is obviously designed to pay for doctors, pay for clinics, pay for hospitals, things of that nature. So they put out a report, the Government Accountability Office, recently that said, you know, there's supposed to be doctors' offices, clinics, and hospitals, not supposed to be hamburger stands, vacant lots, mailbox shops, but that's what some of the 23,000 potentially fake or bad addresses on Medicare's list are. So Medicare, on their list of providers, They have vacant lots, they have hamburger stands, or a mailbox in a post office somewhere, which is absolutely not the way it's supposed to work. So the report says that the Center for Medicare and Medicaid Services, federal agency that administers Medicare, estimates they lost some $60 billion of American taxpayer money last year. Last year. That's more than 10% of the overall budget of Medicare. That's absolutely ridiculous. So, there are some serious consequences if you are caught with Medicare fraud or abuse. And the biggest problem is catching Medicare fraud and abuse. So I'm going to show you how you can help a little bit. And I can tell you, if you're a provider, you absolutely want to understand this stuff too, because you don't want to get mixed up in fraud and abuse, whether it's intentionally or not. So you need to understand exactly the things that are part of it. And I'm going to go through this. I'm not going to go through every single piece of it, just kind of the important parts. And again, if you download it on your computer, you'll have the guide. You can do any of it that you want to do. You can get right into it and it'll help you figure everything out. So right at the top, you can help fight fraud. Report it. That's the number one thing to do, is to report it. And again, you see where the letters are blue, those are clickable links. You just click on the Office of the Inspector General hotline and it'll take you right there. Report it to the Office of Inspector General. It'll take you right there. So all you got to do is click on the link. It makes it very easy. So what is Medicare fraud? Medicare fraud typically includes knowingly submitting or causing to be submitted false claims or making misrepresentations of fact, knowingly soliciting, receiving, offering, paying remunerations to induce or reward referral. So in other words, you can't pay people to bring you patients. You can't pay people to go out and find others that can come to your clinic so you can get paid by Medicare. Making prohibitive referrals for certain designated health services. So you can't refer something that isn't not supposed to be referred for. Anyone can commit healthcare fraud. Billing Medicare for appointments that the patient failed to keep. That may happen accidentally. It gets kind of crazy in a doctor's office, and if somebody doesn't show up for their appointment, they may still bill anyway. And that's not necessarily fraud, and it's just a question of whether it's knowingly or unknowingly, but I'll show you the different levels in just a minute. Knowingly billing for services at a level of complexity higher than was actually provided. So in other words, treating somebody for something but billing for something more expensive. Knowingly billing for services furnished but not provided. So if you didn't get what you were supposed to get, and it can be durable medical equipment at the same time, they can't bill for it. So you need to kind of look at your statement, your explanation of benefits, and just make sure that everything that's on it was provided, and that if there was any equipment, supplies, you got those as well. Paying for referrals, which again, you can't pay for referrals to have somebody come to your business. What is Medicare abuse? Billing for unnecessary medical services, charging excessively for services or supplies, misusing codes on claims such as upcoding or unbinding codes. So sometimes they have something that if it's a complex procedure, it's a specific code, but if they took it and made every little part of it its own code, they would get higher reimbursement for that. So they can't unbind as well. So the different levels, like I said, this kind of gives you an idea on where it goes from to it's a problem. So, you have mistakes such as incorrect coding. They may not have known the correct coding, or improperly or just kind of accidentally put in a different code than they should have. Inefficiencies such as ordering excessive diagnostic tests, bending the rules. Here's where it gets a little bit deeper. So if we start bending the rules, such as improper billing practices like upcoding, or intentional deceptions, such as billing for services or supplies that were not provided. So we, as ourselves, need to take the responsibility to look at our claim forms and make sure that there were no intentional deceptions. If there were intentional deceptions, I'm going to show you in a second exactly how to report it and how easy it is to do, and something that we absolutely should take responsibility for. So there are a number of different laws. You're welcome to look through them. There are links up here in just a minute as well. The False Claims Act, the Anti-Kickback Statute, Physician Self-Referral Law, Social Security Act, United States Criminal Code. It's pretty heavy stuff. And, it's not a whole lot farther from tax evasion type laws where if you are convicted, pretty serious stuff. So again, if you're a provider, you want to understand this stuff and make sure that you do not pick that fight, because it can be a pretty significant fight. So these are the different laws: the anti-kickback statute, physician self-referral. Obviously, a physician cannot refer you to a clinic that they have an ownership interest in. So if they own different clinics or whatever they may be, they cannot refer you to their clinic. So obviously it makes sense. It's kind of common sense, but just something that we don't necessarily think about, are they doing the right thing? So we just got to make sure that we're all doing the right thing. And if we could shave, anywhere part of that $60 billion a year in loss from fraud and abuse, it would just be a tremendous thing. So all these laws are here. There are partnerships that are there to help as well. The Healthcare Fraud Prevention Partnership, the link is right there. Centers for Medicare and Medicaid Services, the link is right there. So they're actively working and they need help. So the Inspector General, Fraud and Prevention, General Services Administration, again, doing everything they can do, but it never hurts if they get firsthand help from you and me. So what to do? If you are a Medicare beneficiary, you can contact CMS. You can contact the Office of Inspector General. There's a link right there if you want to do it online, much easier to do. If you're a provider, same thing. There's a link online if you want to do it that way. If you're either one of the two, you can go to the Office of the Inspector General as well. You can call tips line, or you can click on the link and do it right online. So pretty easy to do. So here we have some resources if you want to look through them. Gives you a lot of information. If you want to get deep into it, you're welcome to do that. A lot of different stuff. There's a copy of the laws if you want to look through the laws. If you're a provider, you might want to look through the laws so that you understand them. And, different things here. There's a whole bunch of information here that is very helpful. So Medicare, fraud, abuse, prevention, detection, reporting. We need to do it all. We need to understand our services. It's just much too important to just not have any interest in it whatsoever. So when you go to the doctor, and again, 99%, everything is the way it's supposed to be. They're all above board, but there are the ones that are trying to take advantage of the system. And there's so much money in Medicare that it's obviously a pretty easy place to go to try and take advantage of the system. So let's do whatever we can to help stop that. And if we do that, then we will just feel better about ourselves. Medicare will be here for the long run. Our kids will be able to have Medicare when they reach that age, and everything just work out for the best. So I hope you found this helpful. And, obviously, if you've seen any of my other videos, I do lots of things Medicare. If you need any help, if you're coming into Medicare, watch some of my other videos. I try to make it as easy as I can for you to understand exactly what you need to do to make sure you get everything set up properly. And I'd be happy to help if you need anything at all. So I hope you have a fantastic day.